Hello and welcome. Thank you for taking a few minutes to be here today. This episode is about cervical cancer and breast cancer awareness, two conditions that affect many women, but when detected early, can be treated successfully. Whether you are young, middle-aged, elderly, or listening for someone you love, this message is for you. Today, we'll talk in simple language, without fear, without judgment, just facts, care, and hope. Let's begin. Why this conversation matters. Cancer can feel like a scary word, but knowledge is power. Cervical and breast cancers are among the most common cancers affecting women worldwide. The good news is this: early detection saves lives. Many women who are diagnosed early go on to live long, healthy lives. Screening helps us find problems before symptoms appear, and that is why awareness matters. Understanding cervical cancer. Let's start with cervical cancer. The cervix is the lower part of the womb that connects to the vagina. Cervical cancer develops slowly over time. One of the main causes of cervical cancer is a common virus called human papillomavirus, or HPV. Most people get HPV at some point in their lives, often without knowing it. In many cases, the body clears the virus on its own, but sometimes it can cause changes that lead to cancer. Some possible signs and symptoms include abnormal vaginal bleeding, pain during intercourse, unusual vaginal discharge. But here's something very important. Early cervical cancer often has no symptoms at all. That's why screening is so important, even when you feel fine. Screening tests like pap smears or HPV testing can detect changes early, before cancer develops. Understanding breast cancer. Now let's talk about breast cancer. Breast cancer happens when abnormal cells grow in the breast. It can affect women of all ages, though the risk increases as we get older. Some common warning signs include a lump in the breast or under the arm, change in breast size or shape, skin changes like dimpling or redness, nipple discharge or inversion. But just like cervical cancer, early breast cancer may not cause pain or obvious symptoms. That's why regular checks are essential. Ways to detect breast cancer early include breast self-examination to know what is normal for you, clinical breast examination by a health worker, mammograms, especially for older women or those at higher risk. Early detection makes treatment simpler and more successful. Who should get screened? A common question is screening only for older women? The answer is no. Screening is important for women of different ages, depending on health advice and individual risk factors.